Hello, it's Dr. Jeffrey DeSarbo, a psychiatrist specializing in the treatment of eating disorders here in New York. And I welcome everybody here to the episode 1 of the NeuroSeries. This one is on really just an introduction to the neuroscience of eating disorders. If anyone wants to know more about me, I did have a introduction to who I am and why this is being done also recorded for the section before this. But let's get started. Before I get into technical information on the neurosciences, a lot of people do not quite understand what is the difference between an eating disorder and people who have disordered eating patterns. And there are a lot of people that can have different types of disordered eating patterns, and an eating disorder is very specific and kind of how a person thinks and how a person acts and their behaviors. And you can also think about the difference between these two, an eating disorder and a disordered eating. Thinking of the 5 Ds of an eating disorder is that they are different. They are actually a psychiatric and medical condition. They're very deceptive. They're hard to detect. They're hidden. It's got manipulative components because people are often so ashamed and feel guilty about their eating disorders. They always want to hide that from others. They're very debilitating. It limits and impacts the lives, people's functioning, whether it's at work or at school. And the amount of intense, obsessive, and emotional distress that goes with it is not what you find in disordered eating. They're devastating because of their impacts it has on relationships. It prevents goals, achievements, and it really takes a toll medically on the body as well. And fourth, they're very deadly, actually. And they have the highest mortality in psychiatry. And it's been getting somewhat better because the treatment of eating disorders has been improving over the years. The treatment centers that are available for people to work with eating disorders have kind of, I don't want to say exploded, but there's more options than there used to be 20, 30 years ago. And these are very intense programs. If you think of disordered eating and an eating disorder, you can kind of see that with disordered eating, it's kind of related to behaviors. There might be some thoughts of guilt and stuff, but think of disordered eating as somebody who might have a emotional eating, compulsive eating, or just, it's like having a bad breakup and someone goes home, they have a pint of Haagen-Dazs, and they feel really guilty about it. But the next day they wake up, they're not concerned about what their eating disorder behavior was that day. An eating disorder, though, the thought component is really what makes an eating disorder an eating disorder. But there are the behaviors as well. So when you look at this little diagram here, they both have thoughts and behaviors. But in reality, if you want to understand what an eating disorder is, and this is what people who suffer understand, it's thoughts. I always say someone can walk into my office and they can be, 6'2" and 80 pounds. And there's a question that I always ask my clients, and I ask them continuously throughout treatment. And that question is, what percentage of your free thoughts, when you're not busy doing things, do you end up thinking about, obsessing about, feeling terrible about? Things like food, weight, body image, calories, exercise. And when somebody's in one of the worst places with their eating disorders, the typical response is, that's 90 to 100% of my free thoughts. And that's where the distressing concept of an eating disorder takes place. In fact, when I'm trying to look at how a person is progressing with recovery, I ask that question. I want to see if it's going from 90, 100% down to, 80%, 70%, 40%. Ultimately, the goal tends to be somewhere between 5 and 15%, which is what maybe the average person thinks about when it comes to things like food, body image, calories, and how they're eating. But when these thoughts are up in that 90, 100%, that's where the distress is. So somebody walks into my office, they're normal weight, they eat 3 meals a day, they have a variety of foods, and there's no behaviors present. And I ask that question, what percentage of your free thoughts do you end up thinking about or worrying about? Food, weight, body image, calories, exercise, behaviors. And they still say 80, 90, 100%. That's what an eating disorder is. And that's what's difficult for other people to know and understand, because they can't see what's going on inside of another person's head. So a lot of times patients will say, they may look like they're doing better behaviorally, or even perhaps when it comes to medical issues and body image. However, if they still have that quantity of obsessive thoughts in their head, that's what's tearing them apart inside. And when others say it looks like you're doing better simply because they don't see behaviors, then that's what causes this disconnect, that they feel they're not understood, and it's very frustrating as they try to work on kind of getting themselves back with their own free thoughts. I always put this slide up here in my talks. He said, which of these individuals here do you think might have an eating disorder? And of course, it's a trick question, because you cannot look at an individual and say that person has an eating disorder, that person doesn't. You cannot see it, because referring to the slides I just presented, you can't see in their head. Okay, so it's not about height, it's not about weight, it's not about behaviors per se. They could have disordered eating or not, but you cannot look at an individual and say they have an eating disorder. If someone's 6'1" and weighs 75 pounds, they may have anorexia, which is a medical condition, but they may not have anorexia nervosa. There may be other reasons for somebody being at a very low BMI. Now, from my perspective, because my interest is in neuroscience and everything, I always put this slide up in my talks just to let people know. When I'm talking with somebody and I'm learning about a client I'm working with, there's several people that, because of how their brain functions, how they think, how they process food and the world around them, it creates this unique image. And based on these 14 NeuroSeries, you'll see there's certain parts of the brain that are affected other than others, that cause different types of effects on body image, self-hatred, and other types of behaviors and thought patterns. Oftentimes I paint that brain, and that's more or less for my own sense of trying to understand how a person is thinking and what's going on inside their head. The one photo that's here, this one here, was painted by one of my clients who decided to paint my brain, and then she explained what it all meant, and I really appreciated that. So in these talks, we're going to talk about eating disorders, and we're really going to refer to anorexia nervosa, bulimia nervosa, binge eating disorder. Those are the kind of like the big three. But there are other types of eating disorders that are classified in the DSM-5. Now, I'm not going to, this presentation here, there's plenty on the internet you can look up if you want the strict criteria for what meets criteria for anorexia, bulimia, and binge eating disorder. And I will briefly go over those criteria in those episodes. But I just want to let people know that I'm talking primarily about anorexia, bulimia, and binge eating disorder, although I will reference some of the other types of eating disorders like ARFID, avoidant restrictive food intake disorder. There's also something called OSFED, other specified or unspecified feeding or eating disorders. And those are things like purging disorder and night eating syndrome. And this slide here kind of gives you an idea that the eating disorders can be a spectrum disorder. So there are some people that can, for many years, suffer from anorexia nervosa, and that may kind of change into a bulimia nervosa or a binge eating disorder, and things can kind of slide back and forth. There's also others who also may develop anorexia nervosa, let's say restricting type, as opposed to there is an anorexia nervosa binge purge type. But with anorexia nervosa restricting type, that may be the primary eating disorder one may suffer from throughout their entire life. And we can find this in some of the genetic research, that sometimes there are very certain types of things that happen that are secondary to genetics and heritability that kind of make one person prone to one type of an eating disorder versus another, while others may slide along this spectrum. So exactly when you think of an eating disorder, like I said, the primary thing, and I always want people to remember, is it's always about thoughts and how much and how much room they're taking up in someone's head and how distressing they are to that individual. But when you look at an eating disorder, there's a lot that goes with people think it's about self-judgment or self-image and how others may look at them and that they're being judged. And sometimes those who do not understand eating disorders may minimize an eating disorder as something that's very superficial, like they just want to look good or it has nothing to do with that at all. There is components of food and control. That's why oftentimes a nutritionist is a part of an eating disorder team. It looks like it's about food, right? Because people are kind of picking their foods, restricting certain types, becoming whether vegan or vegetarian or eliminating certain food groups. And often that's being done in an attempt to control something in life. It's always like the issue with control is a lot of times for anybody, it's hard for us to control how we feel emotionally under stress, dealing with stressors like if there's trauma in someone's histories. We can't control things all the time, our emotions included. An eating disorder kind of gives a person an ability to have a sense of control. You control what goes in, what comes out, what you want to do with it. The people look at numbers on scales and try to control that as a number. So control is a concept that's very common when working with individuals with eating disorders. Now, an eating disorder, of course, is a behavioral condition. That's why, behaviors such as restricting, binging, purging, exercising, misusing laxatives, things like that are all behavioral types of components that play an important role with an eating disorder that always has to be addressed. And it turns into a cognitive condition as well. It changes how a person thinks, how they feel. There's what's cognitive distortions that take place. A lot of people feel, well, if I always say, like, one of the last regions that gets affected in young people with eating disorders who may be in school is their ability to perform academically. So somebody can be getting straight A's in their courses and getting straight A's in physics and straight A's in chemistry. And yet you ask them, if you eat this hamburger, what's going to happen? It'll be like, I'll gain 15 pounds. So they throw the physics out the window. They throw the science out the window. Their cognitive thinking and processing around issues, especially related to food, weight, body image, get distorted. It's also an emotional condition, and when we talk about some of the neurological findings and changes you see with the brain with an eating disorder, we'll show you how there's dysregulation with emotions. And like I always say, somebody comes into my office, parents will say something like, this isn't my son, this isn't my daughter, they're not like this. And with recovery, what you see is I have them back again, okay? And that's related, again, to kind of recovery of the brain and central nervous system. Now, through all of this, an eating disorder is classified in the DSM-5, which is used for psychiatry. And the thing about psychiatry is these eating disorders are a little bit different than most psychiatric conditions because they contain a heavy component of medicine and changes to the body that can take place. So it's kind of half psychiatric and half medical. And psychiatry, of course, is a specialty of medicine. So yes, I'm a physician and I'm a psychiatrist. And I personally have found my way into eating disorders because it is something that kind of keeps one foot grounded in medicine and one foot grounded in psychiatry. So it makes it very unique in all the things that have to be managed, but it also makes it very difficult at times. And what I'm referring to here is how eating disorders and the brain itself, there's kind of this back and forth interaction between the body and the brain. So when one has a change that may take place in the body's functioning with an eating disorder, let's say somebody is restricting and there's changes that take place to the thyroid, you get changes in how the brain and central nervous system function. Or somebody can be struggling with an eating disorder and there can be changes in some of the neuroconnections in different regions of the brain, and that can change how body systems such as the heart and gastrointestinal system and immune system are also affected. And this is illustrated here, and this slide itself is based on one of the talks I've done with a medical doctor on the brain-body axis with eating disorders, how those are double-sided arrows pointing back and forth, that both to the brain and from the brain to each of the body's medical systems. So here you see, of course, the brain and the central nervous system, gastrointestinal, cardiovascular, endocrine, reproductive, immune, renal, pulmonary, musculoskeletal systems. Eating disorders are something that you will find in the research affecting all of these systems. And when these systems are affected, it changes how the brain functions. And then it goes in this cycle, because the brain can change in how it's functioning, which can then change how all these systems function. And like I said, that was a very long, detailed talk. That would take hours just for that. I did pull another slide, however, which is, the gastrointestinal system, essentially our gut, is known as the second brain, and it's because it kind of works even independently of our central nervous system, and it contains over 30 different neurotransmitters, including serotonin and dopamine, and these are the things that people often think of with medications that are used for depression and anxiety and affect the brain and the central nervous system. But there's actually so many neuroceptor receptors in the digestive tract alone. There's more there than there actually is in the brain and central nervous system for things like dopamine and serotonin. So when we're talking about eating disorders, and this can also apply to other types of medical conditions, there's something that I always refer to as the 4 Ps, okay? There's predisposing factors, which in this series we'll talk about. That's things that kind of set somebody up to develop an eating disorder, which can be their genetics, what they've inherited in the family. So that's kind of like biologically based. There's precipitating factors, which are things that kind of make the eating disorder turn on and begin its process, and those can contain both biological factors and psychological factors. There's perpetuating factors, things that keep the eating disorder in place and keep it going and can sometimes make treatment difficult. And that's both biological and psychological factors. And then the 4th P is the prescription. What is the treatment plan, which involves both a psychological approach and a biological approach in most cases. Now, for our intro here, I just want to say, I want this take-home message. If this is the only video family ever see, the general public sees, people who don't really understand what an eating disorder is that an eating disorder is a neurobiologically driven process. And because of that, there's psychological and medical consequences that are fallouts from that process. Okay, so, when I'm working with a patient with an eating disorder, I am looking at it as what's going on with the brain, what needs to be done to kind of bring the brain back to its baseline, and of course medically, anything that may be off medically back to that individual's baseline as well. And finally, it is not a choice. A person cannot decide to have an eating disorder. Even if someone says, I want to see what it's like to be anorexic, so they stop eating for several days, and people have done that and written books, all they've done is kind of experience what starvation is, because whether or not one develops those all intrusive and obsessive thoughts is usually something that is not going to occur unless one is prone to an eating disorder. So because this is our first kind of chapter episode in this NeuroSeries, I'm just going to give you a rough idea of what lies ahead. So this is basically just the introduction. In the second episode, we'll have the neuroscience of some of the research, give you a kind of a broad baseline of what type of research is being done into eating disorders that, again, most people don't know anything about. It's interesting because eating disorders research is found in so many journals. And they're journals that people generally do not go to that when you specialize it. And so over the past couple of decades, I've been going through medical searches for the different journals with articles, and they can be very obscure journals. Some of them are international. And so kind of the composite information for this initial NeuroSeries is based on all these types of journals over the last couple decades. In episode 3, it'll be some more of the neurobiological findings, kind of like the changes that take place with the brain and central nervous system. Episode 4, children and adolescents, will discuss eating disorders in the younger population. Episode 5, NeuroSeries 5, is the neurobiology of binge eating. Then we go into episode 6, the neurobiology of bulimia nervosa. Episode 7, the neurobiology of anorexia nervosa. Then we're going to do another episode on a lot of the neurobiology and neuroscience of the body image. We're going to cover the neuroscience of psychology and therapy and how those interventions actually change the brain and help in the healing process. We're going to, of course, then go into the neuroscience of medications. Do they play a role, and how limited is that role with eating disorders? The neuroscience of thought control is really about the importance of kind of rewiring the brain through mental imaging techniques and mindfulness training and meditation. We'll cover then in episode 12 the neuromedical connections. So kind of like when we talked about that brain-body axis, going to get into a little more detail about that. And episode 13 is the actual neurobiology and the neuroscience of nutrition. Not your typical nutrition lecture, more based on how does changes in an individual's nutrition affect the central nervous system and the brain. And at the end, we're going to do an episode on the family support system, just to help people. People struggle all the time wanting to know, well, what can I do for my loved one? What can I do for my child? What can I do for my spouse? So we're going to cover, some research that's been done to help understand the family support system and some of the treatments that are emerging. Now, for any of those who may be interested in more information of the topics of eating disorders and neuroscience, you can basically find out more information about additional courses, certifications, things like that on neuroscience of eating disorders, as well as some of the programs for those who suffer with an eating disorder and programs for families and parents for eating disorder support that we will offer. And this contact information I'll always put up at the end of each episode, just in case anybody wants to find out, well, how can I get more information on these types of things? Like I said, it's something that I think will be completely different. I hope that most of you will watch every episode because it's information that generally you're not going to come across, and for most people it will be the first time certainly that they've ever had an awareness and an understanding of the neurobiology of eating disorders, which really is the key factor for recovery, is an understanding of that. So again, I'm Dr. Jeffrey DeSarbo, and I look forward to virtually speaking with you more as we continue to NeuroSeries 2, which again will be the neuroscience of eating disorder research. Thank you.